Hello, welcome to Bank of Baroda. Myself, Dr. Ankur Garg, and today we'll be discussing briefly about the current pandemic, COVID-19 or coronavirus. So, what are we going to discuss? We're going to discuss about the COVID-19, what are the signs, symptoms of it, and what are the statistics in India and all around the globe, and how we can prevent it from spreading. And there are lots of things which are at stake because of this current pandemic that we are facing these days. So, main thing about coronavirus that we should know that there are lots of symptoms it can have. Mainly, it will present with cough. The cough can be dry cough or it can be productive cough as well. Patient might have fever. It might be mild or it might be very high. The temperature might be very high as well. And shortness of breath. Patient might be struggling to take breath, and patient might be having some problem with the throat, sore throat, for example. Right. And nowadays what we have noticed, some people, they are having loss of smell, actually loss of this sensation of smell and taste in COVID-19 as one of the very important symptoms. So what we need to do, because a lot of people might be having this COVID-19, but what we are suggesting, not to go to the hospital, meaning everyone should not go to the hospital. It depends. If you have got severe symptoms, definitely go to the hospital. But if you have got mild symptoms, what you need to do, you need to just self-isolate yourself. Right, because in the hospital also there's nothing much we do in terms of treatment. The treatment is usually symptomatic, right? Symptomatic meaning drink plenty of water, keep your immune system perfectly fine, and if you have got, say, fever, we can give some medicine, say paracetamol. But why we are keeping a serious patient in the hospital? Mainly actually because of oxygen, so that we can provide oxygen if they have got severe shortness of breath. Right, plus we can do some routine investigations as well. That's the main aim. So what you need to see, if you have got severe symptoms, go to the hospital. Otherwise, self isolate yourself in your house only. That's the best way that you can deal with this situation. All right, so as I mentioned, like the fever, cough, breathing problem, shortness of breath, loss of smell and taste. This is actually, we are seeing a lot of patients having this problem as well when they are presenting with this coronavirus, right? And who are at risk? Actually, the whole public is at stake or at risk, but there are patients like those who are prone to get these kinds of infection, like those who are immunocompromised. What I mean by immunocompromised, like the patient has got some underlying medical condition. For example, patient is diabetic. For example, a person is having some other medical problem related to their liver, related to their kidney, and in their lifestyle, if I'm talking about, if they are a smoker, drinking too much of alcohol, not having good diet, and not doing any physical activity, so they are actually at risk. And definitely old generation, old people, they are at risk. All right, so risk factors, of course, close contact with the confirmed case, so make sure you are keeping away, you are staying away from those people. And as I mentioned, people having underlying medical condition, for example diabetes, kidney problems, and definitely smoking, alcohol, and not a good diet. That is going to be one of the important factor in case of coronavirus. How it spreads, actually most of us, we are aware of the basic things. How it spreads, it's actually air by, I mean, maybe by the cough or sneeze. So first of all, whenever you cough or sneeze, make sure you're covering your mouth, right? It's not only like, you cannot just save yourself, you have to save the community, right? If you are not putting something on your face while coughing or sneezing, it can spread, isn't it? So make sure you're covering your mouth perfectly fine, your nose and mouth, when you have to cough and sneeze, right? And try not to touch your nose and all with your hand, because your hand will be in contact with a lot of things, right? So try, if you have got something like in your nose, maybe this side, this area of hand you can use, but don't use this hand straight away in contact with your nose and the mouth, right? And cover your mouth when you are coughing or sneezing. That's really important, right? Personal contact, try to avoid it. Don't shake hands, right? We know, like whenever we meet someone, what's the first thing we do? We shake hand. That's really important. But now we have to fight. We have to fight against this pandemic that we are having. So make sure, please, 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 don't do this personal contact, don't share hands, right? That's pretty important. Or maybe you can uh, shake like this, maybe your arm, not the hand, right? And contaminated objects, so make sure you're not touching anything which you are seeing, because anything can be contaminated, and this is how it spreads, right? That's why we are saying don't touch this hands like on your face again and again, right? And keep yourself away from the mass gathering. If you're there in the mass gathering, that's how it spreads. If one person is having this, the whole of the public might get this from that mass gathering. I know the government has not given the permission for mass gathering, but even if somebody is calling you for any function, any mass gathering, say no, because your life is in your hand. So if I talk about the statistics, these are the statistics that we are discussing. That's on 30th of May. Worldwide, you can see we have got so many cases, right? We have got so many cases. It's around like 60 lakh cases we have got. And what we have got, we got 3,67,230 deaths as per the stats, right? And if you're thinking, if you are considering India, India is not behind, right? We have to fight against it. India, we have got around 1,74,000 cases. And you know, if what I'm seeing, like every day we are getting 10-15,000 cases, right? So we have to fight against it. And India, roughly around 5,000 deaths we have seen. Again, I'm telling you, the deaths are more common in immunocompromised patient, but it's not only immunocompromised, because what we have seen, a lot of public, those who are fine, those who are okay, they are also having problem, they're also facing problem, and we have seen many deaths as well. So be very, very careful. All right, so this pandemic, COVID-19, so how to prevent an outbreak, how to prevent it from happening, how to prevent the spread of this infection. First of all, soap kills corona, meaning you have to clean your hands. You have to wash your hands many times. Whenever you go out, when you're coming to your home, or even if you are at work, make sure you wash your hands regularly. That's very important. And it's not like very quick you have to wash your hand. You have to spend some time when you're washing your hand. At least I would say just 20 seconds at least. You have to wash your hand very, very, very quickly, very nicely. You have to wash your hand. And mask, if you can wear the mask, because the spread of this infection we can minimize if we are wearing the mask, right? So please wear the mask, and no personal contact. Don't shake hands. That is very, very important. And of course, what is most important is avoid any mass gathering. If somebody is calling to you for any function, any marriages or whatsoever, say no, because your health is important for you, right? So don't go out in any of these mass gatherings. Doesn't matter how important it is. I think it cannot be important than your own life, right? So stay home if you can, right? If you think you can do your job staying at home, do it like that. Try not to go frequently outside, right? I know, like, you have to go out for your essentials, you can go for it, but again, try to keep lots of things in consideration, like try to maintain the distance, right, when you're going out. But if you can do your job staying at home, please do it. Stay home, save lives. That is very, very important. So what is most important in this current pandemic is social distancing, right? You have to keep distance. When you're talking to someone, don't stand or sit close to them. You have to maintain the gap. What the guidelines are saying, we should maintain 2 meters gap, which is around 6 feet distance, right? So when you're talking to someone, please make sure you are maintaining this distance. Social distancing is very, very, very important. I know that we are going to work nowadays. Government has put us under lockdown, but slowly they are opening, because for the economy, for lots of things, we have to. But what we can do, we have to fight against this pandemic, and we have to be together. So what we can do, keep social distancing. In other words, we are together, but not in the sense that we are shaking hand or we are sitting together. No, we are maintaining this social distancing. That's how we can show that we are together against this pandemic, right? So please maintain this social distancing. let's stay at home if you can. That's really, really important. Not only for you, it's for the whole world, for the whole country, right? So prevention, as we know how we can prevent, that's pretty easy. So wash your hands. As I said, approximately 20 seconds you should wash your hand. Doesn't matter what, a lot of people think like it has to be the sanitizer, it has to be the only the hand wash. Simple soap is fine. Just wash your hands often, right? Stay home if you can and protect yourself and others by putting the mask, and use the disinfectant as much as you can. Wipe objects with the disinfectant, because for example, if I have to give an example, you people are in the bank, right? And you have got your computers, you have got say your a keyboard, you have got your mouse. So what you can do, you can wipe these things with the disinfectant quite frequently, right? Maybe after half an hour, 1 hour, just make sure, take a wipe and just put it on your mouse, put it on your table, put it on your screen, put it on your keyboard. So just clean everything quite frequently. That's how we can protect ourselves and others. And please make sure, whatever is the case, you have to maintain this social distancing. This is what we can do for ourselves and for the country to minimize the spread of this virus, right? And please follow the government guidelines, because the government guidelines are made after discussion with lots of doctors and what's the current trend according to the WHO and all, right? So please make sure you are following the current guidelines given by the government, right? So thank you very much. I hope it was helpful, right? Thank you.